Afternoon all. It's Alex. Just wondering if anybody that's could mute their mics that's not going to be speaking, please. There seems to be a bit of feedback. I don't know if that's just on my recording. And just a quick reminder that that if you have your camera up, then you'll be seen in the recording, which you may not want to be, but you're more than welcome to keep your camera on. It's just that anybody that does have their camera on will be seen in the recording. So thank you ever so much. John, over to you. Thank you.
Thanks, Alex. Hi, everybody. Thanks for finding the time to join in. Feel free to put some questions in the chat box. I know you know who people are, but by way of introduction, from the executive team, we've got lots of things have just come up. Let me just dismiss those. I've got Anne-Maria Newham, Director of Nursing Quality and AHPs. I've got Clare Teeney, Executive Director of People and Culture, and Dr. Julie Hankin, who's our Executive Medical Director. We haven't got loads of questions today, but we've got some very good ones. But before we do that, just a brief overview summary where we got to. You'll all be aware from the national picture of the challenging times that we're still in. The good news is that the case numbers of COVID nationally, regionally and within Nottinghamshire are starting to fall quite significantly, which is really good news. You're all familiar now with the time lag between the impact of that and the impact of reduced hospital admissions and reduced deaths, and then the very high numbers, sadly, of deaths last night. I think it might have been over 1,000 again nationally, certainly 800-900 a day. So it's still going to be some weeks before that those severely ill numbers fall, but they are starting to, which is good news. But appreciating that right across all the health and social care system, people are flat out still, and a massive thank you to all you for your contribution to this. It's making a massive difference, and you know I'm pleased to say continuing to be able to provide key services right across the organisation. And just for example, the number of staff off due to COVID related reasons is continuing to fall slowly but steadily, which is increasingly putting us in a better position. But we're not out of the woods yet. In terms of outbreaks, we've currently got 13 open. There may be another one coming through, but that again, that number that we saw continue to increase has plateaued out, and your continued efforts around infection prevention control, use of PPE, maintaining social distancing is paying off. So again, a big thanks to everybody, and please pass on to your teams our thanks for that continued oversight of that, because we appreciate it's really challenging to keep thinking of that all the time, as well as doing the day job. On vaccinations, again, as the coordinating organisation for the system vaccination programme, we're doing pretty well. The national deadline for cohorts 1 to 4, which are the over 80s, the 70s to 80s, the clinically extremely vulnerable health and social care workers, is this weekend. So by Sunday, we need to be reporting that those cohorts are at least have been offered a vaccine, and obviously the vast majority have received it. There's a slight lack of clarity about what a success is for meeting there's not a defined percentage nationally on that, but we're up and around 90% coverage for those cohorts, which is a tremendous effort. And of course, they're the cohorts that are most likely to get severe illness and most likely to die. So the national effort, I think we're 12.6, nearly 13 million by the end of the day is immense. And the NHS and everybody that's been involved in that should be immensely proud. And I know we've got a lot of our workforce heavily involved, both in providing the vaccines, but also in giving the vaccine, but also in the massive infrastructural effort to get the sites up and keep them running and everything else that's involved. In terms of being able to start vaccinating our patients, that's commenced. So Lingsbar Hospital down in Gampston was done towards the end of last week. We've had vaccines arrive at Duncan McMullen House this morning, and we were starting to, and now we've got permissions to transport those around. The technicalities around the logistics I won't bore you with, but they're quite complex. But we'll have more control over them now, and we can start hopefully beginning to vaccinate those vulnerable patient cohorts from this afternoon, which is really good news. I know many of our staff have been, that's been a big priority for them to be able to start to roll that out. So that's excellent. I think probably I'll leave it there in terms of update. There's loads of other stuff that we could talk about, and if you've not seen it, have a look at the video for the connecting knots we did the other day. There's some really impressive contributions from a number of our people on that, not least around speaking up and our endeavours around continuing to get some really impressive outputs on that. So have a look at that, and I'm going to pause there, Alex, and I'm going to hand over to you and to take us through some of the questions. Thanks.
No, that's great. Thanks, John. As you've said, we've not had that many questions emailed in. Don't know if that's because a lot of people seem to be on leave at the moment. But if anybody's got any questions, please do put them in the chat, or if you're feeling extra brave, please put your hand up and you can ask the questions directly. But there's a question that was asked on Facebook, and I thought it was good to clarify, as there's some there was quite a bit of chatter afterwards around it. And Julie, I don't know if you want to answer this one. It's I've just been turned away at my GP for my booked flu jab. They said I need to wait until I've had my second COVID vaccine, which is next month. I'm sure I'd read that having your flu jab is fine as long as there is 7 days in between. Has anyone else found this? So, Julie, I don't know if you want to answer that.
Yeah, thanks, Alex. So firstly, I suppose I'm sorry that things clearly were difficult at that point in the GP surgery. So I've been back through the national guidance and the Green Book, which really is the ultimate authority on all of this, and checked out again with our lead GPs. So the national guidance is that it is a 7-day gap between the vaccines. They shouldn't be given together, but there's no direct issue with the two being given, and the 7-day gap is really about trying to separate out the side effects. So I suppose what I can't comment on is whether for any individual there might be individual medical reasons for a GP to be concerned, but in terms of just pure timing, the national guidance is very clearly the 7-day gap between. And what we are doing is really encouraging people to continue to have their flu vaccine as well as their COVID vaccine. That's really important. So if anybody is having problems, what we are still running is our internal flu vaccination programme, and we can certainly pick up and work through that with any individuals. So what I'm also going to do is just invite Anne-Maria to talk a bit about that programme and just how successful it's been.
Thank you, Julie. And for those of you who are regular attenders to this Ask the Execs, you know I can't miss a chance to talk about flu. So the big news, the top news is 83%. So each week I've been telling you what the percentage is, and we've been going up slowly but surely. And we had a bit of a jump over Christmas and New Year, which was great. But yeah, 83%. So I can't say thank you enough. You've done an amazing job to get to that point. Just to reiterate, though, still available. There's still clinics. Like Julie says, 7 days in between, really important. And And if you've had your flu vaccination anywhere else, just let us know. There's a form on Connect, or just send us an email, because that'll also contribute to our numbers as well. And actually there is a rating chart, and it does mean that we're in the middle of the patch now. So well done to everybody. There was a target. There's a target of 90%. But more importantly, it's not about the target. Oh, that's my Siri, that's my Siri phone. So yeah, it's not about the target. It's more about, this is good for our patients, it's good for our loved ones, and it's good for yourselves. And also on top of that, remember, because you're a staff employee of Notts Healthcare, that you should go and get your COVID vaccine as well. So we are part of cohorts 1 to 4 as being a part of the healthcare sector. So that's also important for you to pick up the opportunity to do that. And what they want is all cohorts 1 to 4 to be done by the 15th of February. So we will start to talk to you about the second vaccine at some point as well. So just to say a massive, massive thank you to everybody, and keep up the good work.
That's great. Thanks ever so much, Anne-Maria. We've had a question which is been sent in, which is, any idea when people who are redeployed will be able to return to their normal roles? And I don't know if Clare Teeney wants to answer that one.
Hi everybody. Thanks, Alex. I think when you're given the question, that means that we're answering, doesn't it? So, but nicely handed over. Thanks everyone for joining us. So in terms of redeployment, I think the first thing to say is a huge thank you actually to everybody that has been really flexible in terms of how they've worked with us throughout the pandemic. People have been redeployed, worked in different ways, worked from different locations, done completely different jobs, and everybody has been really flexible and agile in terms of that. So the first thing to do is acknowledge that and say that we are and continue to be hugely grateful around all of that. Redeployment, it's meant different things as well to different people. So some people have really enjoyed being redeployed and are actually quite anxious about going back to substantive roles because they like it where they are. Some people are quite indifferent and happy to do whatever, and other people understandably are desperate to get back to the jobs that they love and what they signed up for. So we've got, I think it's important to say that the experience is also different for people, and we absolutely recognise that, and what we want to do is support everybody who has been redeployed. Some colleagues have already gone back to their substantive roles. So again, as I said, the experience is different. Also, some of the time frames, and some people have been redeployed multiple times. So again, it's got all sorts of different connotations. Some people have returned to substantive roles. Some people are continuing to be in redeployed settings, and it's difficult to put an absolute end date on that. So I can't sit here and say to you today, everyone will be back in and it will be back to normal by, because I don't know. I don't know what normal is or when that will happen. I think what we can say is that the more that we learn about how to manage and be able to live to some extent with this with the pandemic and with COVID-19. So we've learned much more about PPE, we've learned much more about staff testing and enabled that to happen in different ways. And now, as colleagues have said, we're well into a vaccination programme. The more of those things that we do, then the more that we can see our lives and our services return back to some sort of level of normality. And with that, we will see an easing off of redeployment. So it's a bit of a mixed bag, I'm afraid. We've got some colleagues that have been able to return to their substantive roles and some that are still in that redeployed space. What I would say is talk to your substantive line manager and also talk to your current line manager in your redeployed setting, because they might be able to give you some more detailed clarity that I can't give you talking generally here. So have the conversations, continue the dialogue. And if it is something that you're finding particularly stressful, then that is something that we need to support you with. So please have that conversation so that we can put that support in and look at your individual circumstances. Hope that helps. And Alex, I'm going to pass it back to you.
Yeah, that's great. Thank you, Claire. Sorry to put you on the spot there. Got another question which you may be able to help with your links to Sherwood Forest as well. I've applied twice now to go onto the bank via Sherwood Forest for the mass vaccination team, both in December and January. Sent numerous emails but not heard a thing. Getting text message each day asking if I can work, but I'm unable to book as not received an EOI account. Is there anyone out there that can help? And that was asked on Facebook, and I thought if you were able to respond.
Yeah,
no,
it's a really good question, and actually it's really useful feedback. So what I would encourage people to do is that is even if it's not something that's a question specifically that you've got, but something that you're experiencing or that you just want to flag, please do it through this forum as well, because it helps us improve some of the services that we've got running and helps us make changes. On this specific question that's been posed, couple of things. So first thing to say is that through Nottinghamshire Healthcare and Sherwood Forest, there has been the mobilisation of a huge staff bank to support the system vaccination programme. And we've got colleagues from both organisations that formed a team to be able to mobilise that. On the upside, there have been over 2,500 colleagues that have been onboarded and are ready for deployment into the vaccination centres as part of that process, which was a huge achievement. That said, we absolutely recognise that we have got some people that are still waiting because of the size of the task. We've just not been able to get to everybody. So we are continuing to work that through. What's being raised here, however, does sound to me like something has gone slightly wrong, because you're receiving text messages which are indicating that what we would call you are shift ready to work, but clearly you can't access your account. So I'm happy for whoever it is, if they are happy to contact me personally, then I can make sure that I navigate your concern through, or alternatively, you could contact Rachel Darcy in the Nottinghamshire Healthcare recruitment team, who will be able to support you to do the same. So please step forward and we'll make sure that we get that worked through for you, because it sounds to me like that's a glitch rather than just us not quite got to you yet.
Excellent, thank you, Claire. And I know that John wants to make come in here as well. And if you're ready, John.
Yeah, thanks. Just to link those last two questions up, really, there's an obvious point to make about the vaccination work is that it's going to be ongoing for some considerable time, which links to the previous question around how long is redeployment going to last for. So without rehearsing what Claire's just said, I think it's a more general point about I guess the question on everyone's lips, isn't it? You know, when can we get back to normal, and whatever that is. There's obviously lots of positives in terms of the vaccination programme, but there's a heck of a lot of people to vaccinate twice, and then there's obviously all the requirements with regard to new variants and remodeling vaccines, and the sense that this may well become something similar to the flu program, where people are going to need different flavoured boosters on a regular basis. There's lots of unknowns about how long immunity lasts, and the full impact of a large amount of the population being vaccinated. Is that going to mean that we can, go out and play and pick up the threads of our previous lives, and without wanting to get too maudlin about it? I guess what I'm saying is that there are a lot of unknowns. It's really difficult to predict. And I guess most people sort of understand that. We'd love to be able to say, look, by June this, by September that, and everything will be fine for next Christmas. And whilst there's a good chance that might be where we get to, we're still level 4 command and control and being told what to do by the central office in London, and it's unlikely that that's going to change anytime soon. And the final thing is about, you know, the two sort of big views, aren't there, that the sooner we get out of lockdown, the better, and we just pick up the economy and get people back to work and everything's going to be fine, balanced against the last thing we want is wave 4, and to, you know, get us back to square one. So I just wanted to put that in terms of context of a national view, but that also pertains to us as an organisation. That you know, we're doing well, but it's really, really difficult to plan ahead any length of time at the moment. As soon as we can start to get a bit more clarity on that, we'll obviously start to share that out. So I just wanted to put that in there, Alex, for a sort of commentary on those 2 points. Thanks.
No, that's absolutely great. Thank you ever so much, John. And Michelle McFarlane has put into the chat, it'd be lovely to have a holiday or a meal out. And I can't agree with you more, Michelle, it'd be fantastic. The final question that has been sent in is with regards to training, and it states, my question relates to the Workforce Development Fund and CPD monies allocated to the trust that I've been informed are at present only allocated for professionally registered members of staff. How is the trust supporting unregistered staff members to proceed with CPD and lifelong learning that results in meaningful nationally recognised qualifications when support workers are unable to access the aforementioned funds? Is there scope for funding applications to be considered on an individual basis according to specific circumstances? Not all support workers wish to become registered clinical professionals within the trust, but do have high aspirations, potential for progressing, and a desire to remain working for the trust. Thank you. I don't know if Claire wishes to answer this.
Yeah, I can provide some feedback on that. So I think it's a really good question. Thanks to whoever sent that in. So first thing to say is that we do get external money in to enable us to provide training opportunities for all of our colleagues. Quite often that comes in through different routes. One of the main routes is via Health Education England. What often happens with external funding is it is quite prescriptive, as the person writing the question sort of indicated, around how we can allocate it, who we can allocate it to, and when we've got to spend it by. So we don't always have choice. And some of the funding that's being referred to there, as was highlighted in the question, was specifically for professionally registered colleagues to be spent over a 3-year period to enable further CPD, continued professional development. So that's one thing. We do, though, have other funding routes whereby people can access support for onward development. Some of that can be via the apprenticeship levy. Again, it has its own caveats about what we can spend it for, but it is available in some instances to staff who don't have a professional registration. We also have a trust allocation, so we do have a training budget. Some of that is held locally within departments and divisions, and some of it is also held corporately. So training needs should really be picked up through your appraisal process with your manager, and that's where it should be discussed in terms of onward courses that might be available. However, if you are unsure or you want further clarity on it, I think what we'll do, because one of the things that we did set out to do and didn't get round to doing this year, it was one of the things that got paused due to redeployed staff that we were talking about earlier, is we did want to have a much more central oversight so that colleagues could also put in bids to do certain bits of training. So what we'll do, and I don't know what the best route is via John's comms, Alex, or some other route, is put out an email so that people can actually put some of their training requests through to that if they've not already been discussed locally, and we can start to pick those up. Hope that helps.
Yeah, that's great. Thank you ever so much. I'll get that sorted and arrange that to happen. Thank you. We've had a question from Mark Howells, and I'm just going to ask Mark if he wishes to ask that directly.
Why not? Hello. Thank you. Yes, so I think for the 2 years I've been here, I've been always confused as to the directorate and division structure. Are we directorates with divisions in, or are we divisions with directorates in? And a conversation recently made it clear to me that I'm not the only one, and I thought I should ask. Can we have some clarity?
Thanks, Mark. I often wonder that. I'd love to know what the answer is. joking aside. I think it's a really good question, because if and we were talking about similar issue at the exec team this morning, that we haven't got a highly visible organogram of that people can just refer to as this is the trust structure. Yes, we are big. Yes, we're very diverse, but you know, I'll take responsibility for that, and we're working on it. In terms of what it is, so divisional is a superstructure. The directorates sit within divisions. So we've got 4 divisions. For sake of organisation, there are 3 operational divisions and the corporate division. I'm, as people hopefully know, very passionate about making sure that we don't get siloed off and just think in terms of divisions. But in terms of just purely a management and governance oversight, you do need a structure that defines them. But it's really important that we create a matrix of networks where people can work across and between and with, rather than just being overly siloed, as we have perhaps a bit too much in the past. And then within those divisions, there are a different number of directorates, depending on which division you're in, and each directorate will feed into a division. We're just starting to get a much greater clarity of what we call a unit of management model. So within teams, there's clarity about there being a clinical director lead, a general manager lead, and a nursing stroke quality lead that works as a sort of that will be a pattern that we can recognise across the trust as being a sort of framework that there'll always be the occasional exception to, perhaps, but it will become part of the DNA. And that's sort of one of the big pieces of work that we're working on at the moment. So I hope that gives you a bit of an idea of where we're getting. And we are in the process of writing that down, and as part of the next phase of comms and engagement, we need to get much greater visibility in terms of what we look like and describing how we are as a trust.
Thank you.
Do you want to come back on that, Mark? Is that helpful?
No, that's, yeah, it was, I mean, I've worked in many trusts, and my experience has been either you have divisions or directorates with departments underneath it. And when I've joined the trust, I found it confusing that we've got both. But as I say, it was somebody I talked to, they've been here 16 years, and even they were confused. I thought, well, I'm not daft, I'll ask the question then. But it's good to know. So 4 divisions and then directorates beneath. So yeah, thank you.
That's great. Thank you ever so much. We've just had a question through from Jenny Newman asking, how can we access money through Captain Tom's funds, and what can we apply for?
Oh, that's a good question. I don't know the technical way that it can be accessed. I know that we're working on it, and in terms of some of the specific areas that the money's been focused on, a large tranche of it is around the staff health and wellbeing. But Anne-Maria can comment.
Yeah, it was just to say that we did receive £95,000 from Captain Tom's monies. A very small working group was put together on the back of that to see how it could best be spent, in recognising that it is about staff health and wellbeing, and that's really what Captain Tom kind of like said he wanted. So there's been a really good discussion around what that would look like for us. So there's a conversation around making sure that people have access to open spaces and maybe things like benches and paths, being able to take some time, space, well-being. So yes, there's a conversation. We've had some money. It's not about us individually being able to apply for any of that money. What was required is it came into the trust, and then it was like how it would be spent by the trust to look at staff's well-being. So you can't make individual applications to it. Claire's got a hand up. She'll be able to say more about it.
No, it's just to reaffirm that, Anne-Marie. I think what it will be useful to do, and again, in terms of putting this out in the comms, is some wider clarity around that and what the money is specifically being allocated to. To my mind, I think that we have communicated that, but given that the question's being asked, I think it's really important that we reaffirm that so that people understand the process and also what some of the money has been allocated to. If that helps.
That's great, thank you ever so much. Dave Owen has his hand up. I don't know if that's to come in about that point or if there's another question. I don't know if you wish to ask. Go ahead, Dave.
It's just sort of at the same point, just to confirm, we did receive some supplies just pre-Christmas. I think Tracy Orlandi organised it, and we had a box full for each of the ward areas where they had coffee, tea, some goodies, that we shared out with all our staff. It wasn't just for the nursing on the ward, it was for the whole multidisciplinary team and the estate and everybody. And we did a thing down here and just said, look, this is from Captain Tom. Enjoy, have a cup of tea, have a conversation, and that's what we did. And that was pre-Christmas, so it was really good. That's it really.
That's great. Thank you ever so much for the clarity on that. And Anne-Maria just has highlighted that they were the care packs, and Jenny's just said that she's had a lot of people ask her about it. So thank you ever so much. We haven't had any further questions sent in, so I don't know if there's anything that any of the execs wish to highlight. If there's anything else, Claire. Thank you.
Thanks. Just a couple of things. So I think Catherine Conchara put in to say about execs wearing their LGBT plus lanyards. It's LGBT plus History Month. So for LGBT colleagues and also allies, and a good reminder of that. And if people want to get involved, I think that Catherine's put a link into the chat. And really, just to say huge thanks for people for sending in for joining in today, sending in their questions, and joining in terms of asking some questions and clarifying some points where other people have got the answers. That's what we want this to be about. So it's really encouraging when people get involved. Thanks.
Thank you, Claire. And we've had another question sent in just as you were talking as well from Nigel Graves, which is how are we updating patients and forensics on the rollout of vaccines, and do we expect any problems for patients from the BAME community in the hospitals? I don't know who wishes to pick that up. Oh, thank you, Julie.
I can pick that up. So what we're trying to do is do it very much on an individual basis rather than mass communications out. So in advance of getting the vaccine, as John said this week, we've been running through with each ward, going through identifying for each of their patients on the ward, what cohort they fall into, whether they have capacity, their views on it, and doing that as an individual assessment and communication. There's also been a small group of staff led by Della Money who have looked in great detail at the resources that we have to help support patients and staff in that conversation, and those are on Connect now. So there are easy read versions, there are accessible English versions, and as wide a range of possible resources as we can put there. The BME forum is also supporting us with thinking about how we ensure that we can talk to individuals in terms of issues they may have around their specific communities, backgrounds, And again, I think it's going to be about picking those up as individual conversations as we go.
That's great. Thank you ever so much, Julie. Claire, you've got your hand up. I don't know if it's a legacy hand.
It is, Alex. Thank you.
That's all right. Thank you. That new term that well, there's so many new terms that we're all getting to know, aren't we? Who thought we'd be saying legacy hand for? Is there anything else that anybody would like to highlight?
Just to finish off, Alex, there's a note there from Jenny around the next CQC readiness session on Friday afternoon. Everybody's welcome to join in on that. They've been really well received, and there's some really brilliant content. And if people have not been to previous ones, don't worry, that they're not sequential, and there's always lots of really good stuff in there. So that's to go in diaries if you're available. Other than that, I haven't got anything else other than to thank everybody for their contributions and another good session. Thanks very much.
That's great. Thank you ever so much, John. As I say, there's as Claire mentioned, thank you for attending. There's 42 of you on the call today, and the session will be recorded. It's been recorded. It's going to be uploaded onto Connect and to the staff Facebook page as well. So thank you ever so much.
Thanks, Alex. Thanks, everyone.
Thanks,
See you
everyone.
next week.
Thanks for all you're doing. Bye.
Bye.